I thank the organizers to give me this opportunity, and we have a post-lunch audience which is almost sleeping, and I would like to wake them up. The wake-up call is integrated medicine. I, for one person, people have been talking about integrated medicine. I practice integrated medicine. I am a radiologist. You know what a radiologist does. I am still practicing a radiology. Right from the time when the child comes in mother's womb, our role starts, and we are the people who declare death. So from birth to death, everywhere, every disease, every specialty, we have a role there. Which is why the idea of integration came to mind, wherein we are seeing patients. Since I do PET CT for cancer patients, I see that the patients never get cured. So there was a challenge as far as the science is concerned. Are we scientific enough? We need to ask this question, are we scientific enough? Like, for example, there might be 10,000 diseases that we know, 10,000, almost 9,900 something diseases that mankind knows the name of these diseases. But there are only two ways to get sick. Have you ever realized that? There are only two ways to get sick. Number one is a pathogen that comes from outside, like the recent pandemic, the coronavirus. Number two is the inside cell becomes pathogenic, like cancer, like diabetes. So inside cell gets pathogenic. So these are the only two ways how a disease forms. There is no third way. If there is, please let me know. There are these two ways. Now, if there is a pathogen that comes from outside, there is a reaction that the body will make. In the recent pandemic, we cured 60,000 patients. 60,000, not one, not two, not 100. Patients who contacted us were saved. Patients who could not contact us, we don't know what happened to them. We don't know how a simple disease like the recent pandemic, people died of it. I'm surprised by it. I'll tell you how. If a pathogen comes from outside, the body is going to react. There are two ways how which the body will react. The first is the body will raise temperature. All forms of medicine are set up to lower this temperature. Are we doing right or wrong? Where is Ayurveda stuck? Ayurveda is stuck with competition with modern medicine. Please understand, competition is human, cooperation is divine. We need to cooperate, we need to understand that if a pathogen has come from outside, it is going to cause fever. The fever is a protective phenomenon of the body. This should not be lowered because you're not helping the body in any way. And we are giving medicines to lower the fever. What will happen in fever? Dehydration. Hydrate the patient. Do not lower the temperature. Automatically in 10 to 12 hours to 14 hours time, the temperature will come down. What is the second option that the body has? The body will lower down the oxygen concentration because the cells that are affected have to die. So what is the mechanism the body has to lower the oxygen concentration? And what did we do? We gave oxygen. Are we helping the patient or harming the patient? And by the way, do we breathe in oxygen? You breathe in air. This device called the body knows exactly how much oxygen to be extracted from that air because oxygen causes combustion. We have read it in standard 7. Have we forgotten it? If you are giving oxygen and the CRP is rising, why are you surprised? You are the person who जिसने आग लगाई है, आपने आग लगाई है. Why are you surprised that CRP is rising? You should have given air. That is exactly what we did. We gave air to the patient, and all these patients are living today. On the 4th day, they started jogging. Coming to cancer, because that is the next pandemic. That is what I feel. That is what practicing integrated medicine, I feel the next pandemic is cancer. Wherein, what are we doing in modern medicine? Cancerous cell is an inside cell. It is a terrorist cell. It knows the surveillance system of the body. It knows the surveillance system very, very well. So when the surveillance system comes, it hides. And then it comes back again and resurfaces. So it behaves like a terrorist. Now please tell me, this August gathering that we have, by killing terrorists, have we killed terrorism? Have we killed terrorism by killing terrorists? What is surgery? Cut it out. What is radiotherapy? Burn it. What is chemotherapy? Poison it. This is a kill phenomenon. By killing terrorists, we cannot kill terrorism, which is why these systems are not effective anymore. We need to integrate it to come to a conclusion as to what needs to be done here onwards. So who can fight cancer? Who can fight? Who can fight? The only thing known to mankind that can fight cancer is your immune system. So anything that boosts your immune system is a tool wherein you can fight that cancer. And that is what we are doing. See, stopping cancer. Everybody is trying to stop cancer. It's not stopping. It's not stopping. Nobody in the world can stand up and say, okay, we have a system and we can stop cancer. No. Nobody is able to do that, please. It might be big talk here and there, but nobody is able to do that. So stopping cancer is a miracle in itself. Making cancer take a U-turn is a miracle in a miracle in a miracle. From U-turn, completely eradicating cancer is unbelievable. We have done it in almost 25 patients. For 25 patients, they are not suffering from cancer anymore. And what did we do? We just boosted the immune system to such an extent. And what boosts the immune system, by the way? We had many products today. I was just saying, people over there, this boosts the immune system. You eat this, you eat haldi, you eat giloy. This will boost the immune system. Did you know that the best thing to boost the immune system is don't eat at all? Fasting is the way to boost the immune system to the maximum, which is why in 2016, Nobel Prize was given to the guy from Japan who resurfaced the science behind this is, if you fast, you will be able to kill cancer. So that is what we do in a nutshell. I am Dr. Awedhesh Pandey. You can find me on the social media. And if there are any questions that are there, I could see some hands going up while I was talking. I would be very glad to answer. In fact, what we do is, while we are treating diabetes, we take 7 days. There is no diabetes that I know that cannot be cured in 7 days. I'm talking about cure. I'm not talking about maintaining a disease. I'm talking about cure. So we do that, and in 4 to 5 days time, any blood pressure for that matter, any blood pressure can be handled, drugs can be stopped, and blood pressure will be normal. So that can be tried. We have been doing it. We have n number of YouTube videos. These patients, we have all the records. I practice integrated medicine in Delhi and Dehradun. We have a hospital there. The name of the hospital is Third Eye. So thank you very much, and if there are any questions, I'll be glad to answer. So ma'am was talking about what kind of organizations, what kind of organisms cause a disease. Let me tell you at the outset, you are made of, are you unicellular or multicellular? Can somebody tell me? Somebody from the students. Are you unicellular or multicellular? Multi? I think you're unicellular. You started with a zygote that was one cell. The adventitious multiplication of that zygote created you. You are 100 trillion cells. Out of that, 90 trillion are bacteria, virus, protozoa, yeast, mucor. 90 trillion, 90%. Only 10% human cells. I repeat, it might not have registered in your mind. You are 90% bacteria, virus, protozoa, yeast, mucor, and only 10% human cells out of the 100 trillion cells that make you. Which means one virus is able to kill you, which means either we have not understood the virus or we have not understood ourselves. So this is the theory that ma'am was talking about, and this is the terrain theory that she was talking about, that most of it is you are in equanimity with these, and when this equanimity is disturbed, diseases occur. That is the dis-ease, otherwise you are at ease. So thank you very much.